Hi guys, welcome back to the channel. My name is Chor Kuan and I'm a medical doctor. And today we'll be starting the first of a series of podcasts called Careers in Medicine. And for this first episode, I've got my friend Ivan Tjiang, who's a general practitioner, and I've known him for the last 8 years. And he's currently working in Kuala Lumpur, Malaysia, and he'll give us a good overview of what it's like working as a general practitioner both in the government sector and the private sector, and what are the challenges you encounter on a daily basis. So I hope you'll enjoy this episode, and don't forget to like and subscribe. And today we'll be talking about what life is like as a general practitioner in Malaysia. So Ivan, can you tell us about yourself?
Thanks for the invite. My name is Ivan. I'm currently a doctor for the past 8 years. I've completed my internship in Johor Bahru, and I've done my mandatory service in Pahang, which is a clinical kesihatan or government clinic. Then for the past 3 to 4 years, I'm currently a resident doctor in one of the clinics in Selangor.
Right. Okay. Can you tell us what brought you to change from the government sector to the private sector?
Well, initially I was okay with the government sector, but soon, as COVID hit, finances became a bit tight, and there was an offer to move here. So hence I moved here to improve my situation.
Right. Was there any major differences you found in working life since you moved here?
Well, in the clinical setting, we usually work office hours from 8 to 5.
Yeah.
But since I am more in the rural area, we do have some passive on-call cycles where we have to be on standby for any emergencies, and we have to attend to them appropriately.
Right. So, yeah.
And as we move on to the government side, the private side, we do have to abide to the working hours of the clinic itself.
Okay. So let's go through this one by one. In the government clinics, what would a typical day look like for you?
Well, government clinics, it depends on where you put into, but you do have to see quite a fair few patients. Like, I cannot say for all doctors in clinical setting, but as for me, I'll mainly man both the antenatal checkups along with the chronic illnesses like diabetes, hypertension at the same time. So essentially, it will be a mismatch of things where you have to finish by the end of the day.
Right. So, in terms of this on-calls you have to do, how many roughly in a month?
Well, it depends on how people see how are the schedules done. But in my case, it will be a week-long schedule of passive calls followed by rest, where another of my colleagues will be attending the patients at night.
Right, and how many people are on this roster roughly?
Well, again, this is depending on the size of the clinic itself. For my one, is a small rural area. We typically have about 2, sometimes maybe 3 doctors overall.
Right.
So it'll be shared between us, and any arrangements will be done in that fashion.
Okay, so it'll be 2 to 3 doctors at a time, and then you do a rotation.
Yes.
And is this always in everyone will be there in the mornings?
Yes, that's definitely.
Okay, and how many patients would you say you see in a day, roughly?
Roughly, well, during the time, if I'm not mistaken, I might see around 30 to 40 patients per day.
Right. And do you find that these patients were simple to manage, or time was very limited?
Well, time is very limited because you have to handle both sides, the outpatient department, where you will see the what you typically see, like cough and cold, some chronic patients with diabetes and hypertension, along with the antenatal checkups, which will take some time.
Right. And yeah, I would think that would be quite challenging because myself, having worked in the government, I agree that antenatal checkups would take a lot of time.
Yes.
And this can be quite complex, especially if you're not familiar.
Yes. Fortunately, they did give us some basic training before we started, and the rest we just adapted, learned, and then improved upon ourselves.
Yeah. Now, would you say your housemanship would have helped you a lot? I think we've both been through 2 years of this.
Yes, that housemanship definitely will help a lot because because the whole point of housemanship is to prepare you for all these unexpected situations.
Yeah.
Yeah. You may be hoping to become a certain specialty, but you don't know what life brings you.
Yeah.
Yeah. So definitely the experience and definitely the training, no matter how hard it is, it definitely brings a positive impact on what you are later on.
Yeah, no, that's true. We never know what's coming through the door, and it's always good to be prepared there. So, all right. So, now we've been through what is like to be in the government sector and what it's like to be in the private sector. So now, what do you think was the biggest challenge when you initially moved out from government to the private sector?
Well, in the government sector, you do have a set of rules that you have to follow, guidelines, and also you do have some restrictions as a, how should I put it, as a medical officer.
Yeah.
In comparison to a family medicine specialist or a specialist from the hospital. There is a limitations on what medications you can give, and you have to work within those limitations. And if it is too much for you, you may have to refer them further up the chain.
Right.
And as for management wise, private sector is a bit more free. It's a bit more flexible. But it also is limited to what medications you have on hand.
Yeah. All right. So, if you had, for example, these difficulties, how many of these patients would you have to refer on? Or
Well, with difficulties, we do have to refer quite a few patients out, so to get their conditions properly managed.
yeah,
Same also when I'm in the private sector,
yeah,
because that's the main thing about being in primary care. We do have to know what we can manage and what we cannot manage. We have to be certain to refer when it is necessary, and we have to consult the patients to visit the specialists, no matter from which side, the government or the private side.
yeah. So, I think a lot of our viewers here would like to know the initial part of becoming, well, I think I'll rephrase that. The initial part of transitioning from the government sector to the private sector. What's it like? What's the process?
Well, initially, you, like all jobs, you will hand in your resignation letter, and then you will state reason whatever may be. Then as you transition to the private sector, first you need to make sure that your service books is processed and collected, because you do need it when you are applying for your annual practice certificate for the following year.
Right.
Yes, and also make sure to set up an indemnity insurance,
Oh, yeah.
because you do need that in the private sector. Yes, you need to update your details and your documents inside the system, and then you have to apply.
Yeah, actually, my experience was quite similar. When I did leave the government service, I think there are a few things that we need to get. I think the first thing would be the resignation letter, and then the service book. I think that's what that details which hospitals you worked in, how long you've been working, and I think anything else we missed. I think
That for the most part will be there, because the rest will be done previously. If I remember correctly, you need your university certificate, your identifying documents, and I think that mostly covers everything.
Right, yeah, because I think the first year you renew the practicing certificate as a private doctor for the first year. That's
Yes.
usually the hardest.
Exactly.
Yeah. I think they give a letter as well, right?
Yes, they do give a letter.
Say this is your statement. This is your last day in the government, and
Yes, like the
Yeah,
letter of
really
resignation. Yes.
and yeah. I mean, let's say if someone wanted to go out into private, let's say I'm a doctor in the government service and I'm thinking of going to private, what are the things do you think I should consider first?
Well, you should consider what is the reason for leaving the government service.
Yeah.
Because leaving into private service, there is a competition.
Yeah.
The pay may be higher, but you do have to be very fluent in customer service.
Yeah.
Because in the end, when you are treating patients outside, you're not just treating them as patients. They are your customers, they are your guests. You may have to use your professional discretion for how treatment is done, but you still have to speak with them as politely as possible.
Okay. And yeah, I think in the government setting, we will always rush for time,
Yes.
the endless number of patients. Would you say private sector is roughly the same, or?
It will be the same. It will be the same regardless of where you go. If you head to a busy clinic, yes, you will see a lot of patients in a short amount of time. So sometimes you can only allocate about 5 to 10 minutes, same you'll see in the government service.
Yeah.
But still, customer service, speak to them with respect, speak to them appropriately.
Okay. Now, I think one of the main factors that drive people is they want a bit of work-life balance when they transition. Would you say your work-life balance has improved after transition?
Work-life balance is a different thing. In a government service, you have a fixed time.
Yeah.
You have a fixed schedule. Your weekends are off. That, for some people, is the best work-life balance.
Yeah.
They can spend a lot more time with the family. Their hours are more regular.
Yeah.
But for private sector, it depends on the clinic itself.
All right.
It depends on how you negotiate your time. What is your schedule? What are the opening hours? What are your working days? So essentially, it's hard to get a proper work-life balance because you do sometimes have to work weekends.
Right. So I think, for example, when I used to work in the government setting, I used to work, let's say, from, I would say 7 until about probably 5 or 6 p.m. And I would have to do on-calls on the weekends. Was that similar for you?
Well, in a way, similar yet different. Because my schedule requires me to sometimes work full days or Sundays. And for sometimes I do have to work continuous day shifts during the weekdays. So it depends on what you're looking for.
Yeah.
Sometimes some people might listen to this and say, oh, it is very tiring.
Yeah.
But it depends on what you are looking for. Whether you want to be more financially enriched, or do you want to strike a balance, or do you want more rest?
Yeah.
Ultimately, it's up to you to manage.
Okay.
In private, there will be that flexibility.
Right. So it's all entirely dependent on you how many days you want to work and how much,
Yes.
how many hours.
Yes, but it also depends on how you negotiate with your employer,
All right. Now,
or if you
Yeah.
have your own practice.
all right. Now, I think like to know what's a typical week like for you. Like how many days roughly, how many hours?
Well, I typically like to work a little bit more, so sometimes I spend 5 to 6 days working, although sometimes in one place, sometimes in another, but I will definitely have to take a day off to rest.
Right. And how many off days roughly? Twice a week or
Twice a week.
Okay, no, that's good. I think work-life balance is very important because it's important to get that rest before we continue working.
Yeah,
and
indeed.
keeps your mind fresh.
True.
Now, let's see. Now, moving on, I think in the government sector, there was a lot of administrative process involved. I'm sure there was a lot of paperwork. Is it the same in the private sector? Or?
Yes, same if not more.
Okay.
Because you do have to fill out reports. You still do have to fill out forms for this and that, mainly for administrative purposes, sometimes even for making any medical reports.
Yeah.
Yeah.
Okay. And in terms of administrative, is it like stock checks or?
Sometimes.
Okay. And would you say this takes up roughly an hour a day or more?
Well, sometimes you do have to sit down on your off days to work on it.
Okay. So, Ivan, the next question I think most of our viewers have in mind, and myself included, what's it like job hunting when you're in government transitioning to private? What goes on?
Well, job hunting is not easy because once you leave the government sector, you have two choices. One is to join already established clinic, or second, to establish your own. For me, I do want to gain some experience before deciding on anything else. So, and due to the circumstances for me moving out of the government sector, I prefer to work at an established clinic. I've been working at a clinic. Before this, I've been working at a clinic, which part-time during the weekends. So to gain how to manage private sector patients, so to gain the experience, and I joined the clinic soon after.
Right. Then what are the typical conditions you see on a day-to-day basis?
Meaning?
Like people, what kind of problems do they come in with, or medical conditions do you manage on a day-to-day basis?
For the most part, it'll be just the normal cough and cold, diarrhea, vomiting, sometimes with fever. But for others will include injuries, lacerations, sometimes cleaning up after accident. Then there will be patients who require some advice, some consult. You don't necessarily always have to cover medical related issues. Sometimes you might have to cover other types of issues like family disputes, and also even sometimes you might see a few people who are depressed, who have no one to turn to and no one to talk to. So, as a primary care, we have to listen to these concerns and to give appropriate advice.
Yep.
Yeah, if we are unable to, please direct them to the correct professionals to help. Yes.
Yeah. So it sounds like a very broad skill set you have there, because it sounds like not only are you managing the medical patients, you've also had to do some minor surgeries as well.
Yeah.
You're also dealing with the social issues and also psychiatric issues.
Yes.
No, it sounds like it encompasses quite a bit. Was there any specific things you found that like courses or something you found helpful?
Courses wise, I think the course of just trying to empathize with people, eventually being one that that all your patients can trust is the important thing. But gaining experience is also another thing. Usually I will join multiple talks on various topics to learn and to try to bring it into my practice.
Yeah. So with the experience in the clinic, Kesihatan, would you say that actually played a huge role in helping you in your career, or do you think someone could just venture on from hospital life straight to GP life?
For my experience in clinical Kesihatan only deals with the basics.
Yeah.
It does not deal with the customer service aspect of the job.
Yeah.
And I do not recommend people just jumping out of hospital and straight into a clinic. Ease into it, because it will be vastly different.
Yeah.
Dip your toes into it. make sure that you are comfortable with leaving.
Yep.
Make sure you are comfortable with the job, because this will be what you have to do.
Right. Now, in terms of job hunting, where do people normally find these job advertisements? Do you find yours online, or is it through experience? Or
Through experience and just working in multiple clinics until my current employer offered me the job.
right, so would you say that's the same for most people? It's kind of like you start doing the locums outside, and they find a successful candidate or someone suitable, and then
That is one of the most likely routes, but there are clinics who are attempting to hire. You may look into that.
right. Are you aware of any like Facebook groups or
Unfortunately, no.
or WhatsApp groups that?
No, unfortunately, no.
Okay, so it's mainly through the locum groups. You would say that's the best way in.
Yes, at least that is my way.
Yeah, I think that's what I've heard from a lot of people too. So, yeah. Well, I think now we'll move on now to the financial aspects of working in general practice. Now, when you compare working in the government, how would you say that compares to working in the private sector?
Well, financial wise, the private sector does pay more,
Yeah,
but the government sector is stable.
yeah,
So it depends on how you're looking for. If you, like I said, if you're trying to strike a work-life balance, then maybe a government side is for you. Or if you can get a good deal on a schedule in the private sector, that is very good as well.
right. Now I know this is very taboo, very sensitive. I know this is a very sensitive topic for a lot of people. But what's the rough salary like for a government doctor, and what's a rough salary like in the private? Just a ballpark figure, a range.
Okay. Let's just use a typical doctor of 4 years.
Yeah,
The 4 years, 5 years service. Usually the range will be around like 5 to 6,000. But for it depends. For a private sector, that you might have it to 9,000, 10,000, but before taxes, both sides.
right. So it's not that big of a difference, is it?
Yeah, it's not that big of a difference.
Okay, but I'm sure the extra helps a lot in terms of feeling more comfortable and financial commitments.
Definitely.
Okay, but I'm sure, if I understand this correctly from what I've heard, it sounds like you do work much longer hours compared to when you were in the government.
Yes, I do work much longer hours, and I do sometimes longer hours overall, including the weekends.
Okay. Oh, sounds like well, there's a balance there, so it's a give and take.
Yes.
All right. Let's just share some words with our viewers. I think they'd like to hear a bit of your personal experience. What do you think, reflecting on your journey, what do you think was the most rewarding part of this transition from government to private?
Well, the most rewarding part of this transition is that you see a wider world. You see a wider worldview other than the mundane day-to-day section of the government service. And you do see more and more varied personalities.
Yeah.
Yeah, you can see very friendly patients. You can see very rough patients as well. And being in the private sector right now, it is somewhat freeing in a way.
Yeah.
For me personally. I do not mind working in the government sector because they also have their own set of benefits.
Yeah. But yeah, it sounds good overall. I mean, it looks like we have good things, and then we've also got things against working in both government and private. But yeah, it sounds like we have a very balanced overview here. Let's see. Now, for someone who is about to make that transition, what advice would you give to other doctors who are about to make this transition from government to private?
Firstly, I would like them to actually try before you jump into the private sector, because the private sector is not for everyone. I do have a small story about one of my previous consultants
Yeah.
who has left the government sector for private service. Although he is a consultant, but he's unable to make a business thrive.
Yeah.
So hence later on he returned to the government service.
Right. I think,
So dip your toes in before you get wet.
Yeah.
Make sure that you try and think about it, whether it is a good idea for you to do. If you're planning to become a specialist later down the line, leaving the government service might hurt your chances.
Yeah. Now, that's okay. Any particular supports or groups you found helpful to get advice on this? Or
I don't have anything, but it will be nice if you actually talk directly to a person who's currently in the private sector,
yeah,
or even if your specialist has time, you can consult with them and see what are their opinions.
all right. Yeah, so sounds reasonable.
Yes, and make sure to discuss with anyone concerned, be it your family, your friends, someone that can help you come to a decision after weighing everything.
Yeah. So in summary, it sounds like before someone makes the transition, I think the most important thing is they give it a trial.
Yes.
It's possibly best doing some locum work outside.
Yes.
Yeah, ideal. And that's probably some of the weekends gone.
Yeah.
So in the government setting, you still have the weekends off, and those are probably best spent doing locums if you're considering.
Yes, definitely to consider what you want to transition to. You can transition to private hospital if you like the hospital life.
Yeah.
But you have to try everything before you actually jump.
All right. All right.
Before you leave the service.
Okay, no, that makes a lot of sense. Well, thank you, Ivan, for being here on the show. I think we really appreciate all the lessons you shared with us and the experiences you shared. And I think, in summary, this has been a good session to help our viewers make a decision on whether they want to stay in government or whether they want to consider a life in the private sector as a general practitioner. And I think we've got good snippets of advice. So thank you everyone for tuning into our podcast. And we will see you again in the next episode. All right, and we've reached the end of our episode. Thank you very much for tuning in, guys. And let me know what you'd like to see in the next few episodes. Don't forget to leave a comment below. Leave a like and subscribe if you'd like to see more. And thank you for tuning in. I'll see you in the next video.